Hello, everyone. My project was creating an invisible bias workshop for SLPs. Many of us are white Caucasian women that are working in a diverse environment, and we need to realize all the places that biases may appear. And this workshop is to help point out those biases while showing us how to develop cultural competence. This training is very important when we work with diverse patients and family situations. Um, our field is all about communication disorders. Communication isn't one way, and if our receiver isn't perceiving what we're saying, we're not communicating anything. But what and how we communicate is very vital to our role as SLPs. What we say matters. When Coca-Cola was first introduced in China in the 1920s, the translation was bite the wax tadpole. Would you want to drink that? Another example of some language cultural differences, Valentine's. If a student is moving to the United States from another culture or country, they are not going to know that they need to provide Valentines for an entire class. They're not going to know what a Valentine even is. And then things like I loaf you, the play on words, that would be hard for them to understand as well. Okay, then I go over some definitions: bias, diversity, cultural competence, cultural responsiveness slash pluralism, which I think are very similar terms. So we go over those so the participants will know what I'm talking about. And then we talk about self reflection first, because the first step is knowing yourself. These handouts were for them to take home because I want them to reassess and take time on these long forms and come back to them in the future. But for the workshop, the activity involved is taking these categories, taking an adjective to describe yourself for each category, then choose three areas that influence your own identity the most. Recall an event that is related to those areas and how it's affected your treatment toward peers or clients. Because knowing yourself helps frame how you're getting to know clients and how you're treating others. As SLPs, we are ethically and legally bound to practicing cultural competence with our clients. Here's an excerpt of our Code of Ethics. And then we have a Bill of Language Rights. I'll point out number 10, the right to have access to service providers with training in culturally, linguistically, and historically responsive practices. Bingo, that's what we're talking about today. So, some scenarios. Ethical violation. Well, we have a refugee child needed hearing testing. A student tested the hearing, then exclaimed, Pierre couldn't even raise his hand for the screening. All these foreign children I tested were dumb. Now, there's a lot more going on here, but the clinical provider, the educator, pointed out the problems here. Obviously, there's a problem, but gave some additional training on refugees for the student. The student could have been disciplined by the graduate department, and if was a licensed SLP, could have had even more serious consequences. Okay, then a group discussion around this scenario, engendering cultural responsiveness in clinical practice. And this time, the clinical educator makes a statement about the client's mother. Did you think she was a man? Saying this to the student training as an SLP. So then we discuss, does gender identity of caregivers matter? Should the student have reported their clinical educator? Those kinds of things. Okay, in certain situations, if it's a socioeconomic status that's lower or an underserved or underrepresented population, SLPs are already working as teams with other healthcare providers for that person, so they can also advocate for the patient and family. If you see a social injustice, say they want to put the child in foster care, but the family's doing everything they can, and there's a misunderstanding in some way, advocate for them. Okay, another situation is where we have twins that were, moved to the United States from China, the boy twin had a diagnosis of autism spectrum disorder, had SLP therapy, but the SLP started using a speech generating device before talking to the family. The family was very upset, stopped the treatment in place of acupuncture and medicinal herb treatment. So we don't want that. So we talk about that. Then we do some role playing, breaking off into small groups where we focus on dialogue, listening for understanding, not debating. And we use this activity, activating allyship. It provides scenarios, perspectives, and potential influences. So we talk about those in groups, then we get back together and talk as a larger group, and we start trying to bring in different cultural competent concepts and try to frame those. And then finally, we talk about biases that are in assessments and treatments. Standardized testing, that's mostly developed for Western literate middle class children. So don't use this if you have a child that's not Western literate middle class. There are alternatives for testing. And then as far as culturally competent treatment strategies, use music, it's universal. Use stories that relate to their culture. Encourage bilingual use if it's relevant. Multicultural items, pull them in. Avoid microaggressions. Don't use deficit language in reporting. So the key takeaway, cultural competence exists on a continuum. We want to be constantly self-reflecting because our cultural competence will change and develop. And we have to begin that today, now, no questions asked. Okay, so then I provide them with some resources to further continue their education, some things to look at their practice, their policies and procedures. And finally, I will say that I met 5 of the Nebraska skills in this workshop. The participants should have been able, by specific scenarios, to self-assess and role play with all these values of other societies in mind. We should be able to recognize and deal with dehumanizing biases, etc. Again, those discussions, those scenarios, those specific situations dealt with that. Number 3, the ability to translate knowledge of human relations into attitudes, skills, and techniques for favorable experiences. Again, when assessing a patient, use techniques that's relevant to them. Therapy, techniques that's relevant to them. I gave some examples in this workshop of how to do that. The Bill of Language Rights, respect for individual rights, and then the ability to relate effectively to other individuals and groups in a pluralistic society. Again, a lot of those strategies and scenarios and role playing help with that. Now, if somebody were to be difficult, I would say acknowledge it. We need everyone's buy-in to have a cultural change. But hopefully by doing that self-reflection at the very beginning encourages an open-mindedness, encouraging dialogue, not debate. And then, staying calm as a leader myself, modeling, treating everyone with dignity and respect, and saying, I expect that for everyone. And then remind everyone, this is for all of our benefit. This isn't just for one particular group. So thank you for listening.